Chair Livingstone, Chair Kennedy, I'm deeply grateful for the opportunity to testify before you today, and honestly, I seem to have scored the jackpot in that 4 of the bills that I have the privilege of sponsoring in the Senate are being heard by you and your esteemed committee members today. I'll speak very briefly about each of them. We'll submit written testimony, and of course, I look forward to working with you and the committee on this really essential work. I'm here as a legislator and a mom, and my experience as both informs my views on these bills. First, I'll take them in order. S64, an act to support families, filed along with Representative Garbally. As you know, chairs, currently Massachusetts law dictates that the birth of a substance-exposed newborn triggers an automatic obligation on healthcare providers to report the birthing parent to DCF for suspected abuse or neglect, even if the substance was prescribed to the pregnant individual for addiction treatment. So this bill would remove the mandatory reporting requirements and would protect, we believe, nearly 800 families a year from the stress of unnecessary DCF involvement. This issue was raised with me by Boston Medical Center, and I want to thank them for their good work and the work that they do on behalf of patients and the communities. Second is S65, an act protecting benefits owed to foster children. I want to thank the Disability Law Center and the Committee for Public Counsel Services for bringing to light what I would consider, chairs, respectfully, a true scandal, and then proposing legislation to fix the problem. In a nutshell, when a young person in the care of DCF is receiving federal Social Security benefits, either supplemental security income, which helps children, as you know, with disabilities in low-income households, or Social Security survivors benefits for children of a deceased parent who paid into Social Security, DCF currently puts 10% of the benefits into the child's personal needs account, but then takes the remaining 90% and deposits it into the state's general fund. This is a public agency taking essentially public funds that are dedicated to youth in its care. When a foster child then ages out of care, these vulnerable young adults don't have the benefit of this financial safety net to help them out. We believe this affects approximately 1,250 young people annually in Massachusetts. Sadly, this practice, which came to light through a flurry of investigations by press and legal advocates, occurs in many states, but thankfully that is beginning to change. 9 states have recently ended the practice. Many more, like us, are considering bills like the one before you and your committee. So you're going to hear much more detail about this policy and why this bill is the right thing to do. Third is S66, an act establishing the Massachusetts Foster Care Review Office, which was also filed in coordination with Representative Farley-Bouvier, and I neglected to mention I have the great pleasure of a partnership on S65 as well. Under the federal law, states must have a foster care review system. I know you heard from Representative Farley-Bouvier prior to hearing from me. Let me just say that this has been a bill and a conversation that the representative and I have had the privilege of working on, and it really essentially just asks for an external review office, and it transfers the responsibility of foster care case review to this external foster care review office. Now, I am very grateful for and I recognize the strengthening and improvements made by the child advocate. I do. And I still think this is a worthy conversation to have with the committee. And finally, S68, which I have the privilege of working on with Representative Finn, this bill complements the legislation we passed last session, which spelled out a series of rights for foster parents. This bill is an act establishing a Bill of Rights for children in foster care. So parents last session, hopefully children this session. The bill directs DCF to inform children in their care about a number of existing protections. So it doesn't create new protections, but it actually bundles them, and it requires some more direct communication and a tad more accessibility and transparency. It mirrors similar legislation passed in other states, and it was drafted with the input of child advocacy organizations, legal groups, and a former juvenile court judge. And again, thank you for this committee's report, favorable report on the Foster Parents Bill of Rights last session. We hope for this bill this session. So thank you for your consideration of 4 of these proposals and all of the work of this really essential committee.
Thank you.